Dr. Batchelor has done a lot of work in clinical trials and in adequate representation in clinical trials and trying to overcome the cultural and social and structural barriers that exist in our healthcare system.
You know, this is an under-discussed topic in general, and especially in the African American community, and we have disparities in clinical research. The two kind of go hand in hand, but I think collectively, all of us need to be talking about this.
Yeah. Of people on Medicare who are diagnosed with heart valve failure, only 5% are Black and only 1% are Hispanic. In other words, many cases of heart valve disease in these groups might be getting missed.
Compared with white patients, Black patients are 32% less likely to be diagnosed with aortic stenosis in general, and are 74% less likely to be diagnosed with severe symptomatic aortic stenosis, also known as heart valve failure.
Black Americans may be at an increased risk with the early onset and detection of valvular heart disease. It is important for us to be aware of our patients when they come in for an assessment, to evaluate their symptoms, and just getting to know what's going on with the patient.
Another group of people experiencing this are women. They're being diagnosed with heart valve disease much later than men. Women are at greater risk of death from heart valve failure than men, possibly because they are referred less for treatment. So reaching out to those communities is very important. The second thing is the healthcare providers themselves being aware of this disparity and doing what they can to not necessarily put off these symptoms to other things.
But you know, doctor, education is a big word. And as I listen and listen here to you, I think the method by which we think we are addressing the community needs to be changed.
Absolutely. I think it's multiple factors, to be honest. Being able to actually trust your provider, making it to the doctor in the first place, that's key, right? So in the African American community, there's a lot of patients who have a distrust of the healthcare system for lots of good reasons.
You know, that is true. That is true. You have to trust. You have to really be honest that you are afraid of something, because the only way you can attack the fear is to know you got scared in the first place.
I think it's important for us to be mindful of our patients when they come into the office and kind of meet them where they are. But it's so important for you to not be biased and understand what's going on with the patient.
We as a Black community have got to be willing to participate in clinical trials.
For instance, I'll just use me. I particularly never heard about being involved with a clinical trial. Will you be interested in helping someone else? I say, most definitely. How can I help?
If you get an opportunity to participate in research, I would advocate for doing that, because if we don't have that information on folks that look like us, then how do we know with 100% certainty that that device, that drug is going to work as stated and be as safe as it is in another population?
Because the bottom line is we don't have to die from this disease.